Ebola coming to the United States is very, very, very unlikely. In fact, almost impossible. This is SAC Health Answers, a program where we answer your questions about your health and well-being. I'm Dr. Jason Lohr, CEO here at SAC Health and a family doctor. I'm also a tropical medicine and travel medicine physician. And we have a question actually about Ebola and could I get Ebola? What are my chances of being exposed to Ebola if I live here in the United States? And there's a lot of questions coming up about Ebola right now. In the news, there's a lot of fear that Ebola could come to the United States. One thing is clear, Ebola coming to the United States is very, very, very unlikely. In fact, almost impossible. First of all, to contract Ebola, you have to have direct contact with body fluids from a patient who has Ebola that's positive for the disease. This is very rare and really only happens in settings where family members are taking care of bodies after they die in preparation for burial. And that's why it happens often in places of Africa where that is one of their traditions. The other place that it could happen is also in a hospital setting where a patient is having profuse bleeding or profuse vomiting and exposing a healthcare worker to a high amount of body fluids. That is the only way that Ebola is spread. It is not spread through respiratory droplets or spread through coughing. It is not in the air. And so if there is not a direct contact with a patient with Ebola through their body fluids, the other person will not get infected. That is important to know because this is not like COVID. This is not like the flu. This is not like any pandemic we've had in the past. In fact, it really will be more likely isolated to its local area. Right now, there is very good public health focus on the area in Africa where there is a current outbreak and folks are not traveling, they're not moving, they're not crossing borders, they're not getting on planes. So the likelihood of anyone being exposed and then coming outside of that region on a plane or another mode of transportation is very, very, very unlikely, if not impossible. So rest assured, I know we have World Cup and other events coming. Rest assured that this will not become a public health issue that we need to worry about at this time. Thank you for joining us, and I hope that you stay informed and stay healthy. And remember, your primary care doctor is your partner in your health and well-being.